Thank you very much, Dr. Sarah, for this interesting lecture, actually. And you talk about the benefit of weight loss and IH guidelines and modalities of management of obesities. We will open the floor for discussion. Any question? Any question? Yes? Excuse me? Yeah, there is one question, Doctor.
Thank you, Dr. Sarah. This is Dr. Waleed Kaplan. I'm a pediatric endocrinologist, your neighbor at Tawang. So I do see adolescents with obesity, and unfortunately, out of the many options you have listed, only a couple are approved in children or adolescents. I know your topic is about the medical management. Now we know that the other part is the surgical. So when do you give up on medications and you refer the patients to bariatric surgery?
Assalamu alaikum, Dr. Waleed. I'd like to thank the organisers for inviting me, and thank you for the lovely question. As you know, childhood obesity is a huge problem, and that's an entire talk in itself. You're correct. In children, the only medication that are safe and licensed are Xenical and liraglutide. I would probably argue that Gelesis, which is not really pharmaceutical at all, is worth trying. It's not available in the UAE yet. When do we progress? That is a complicated question. So we're very lucky between Imperial College London Diabetes Centre and HealthPoint. We have a multidisciplinary team and we meet once a week to discuss these cases. We need to look at the risks to the child. So do they have severe sleep apnea? Do they have uncontrolled diabetes? Do they have something beyond weight, which would make us think that the risk to them is sufficient for them to go through bariatric surgery. They have to have at least 6 months of lifestyle management with a trained dietitian. We do try medication, and in those who do have obesity with significant comorbidities, we do consider bariatric surgery. I hope that's helpful.
Yes, it is. I meant in adult, not in adolescents. I face the challenge. But in your practice for adults, when do you tell your patients, you know, we've tried enough in medications, now it's time to consider surgical option?
Okay, so that's an excellent question. Thank you. As I alluded to in the talk, it is sensible to try more than one medication. Some people will respond fantastically to a medication and not so to another. Particularly with GLP-1 agonists, we're seeing fantastic results now with semaglutide. We would give them at least 3 months of titrating up the dose, and then another 3 months. If after being on full dose for 3 months in a medication, whatever medication for obesity, a person does not respond, they will not respond, and there's no point continuing with it. For bariatric surgery, their DOH guidelines are excellent. And basically they suggest that for people with severe obesity and a BMI of over 40 who have tried lifestyle, possibly medication, then bariatric surgery is a good option. And for people with uncontrolled diabetes, we would go down to a BMI of 35. And people with other comorbidities such as high blood pressure, high cholesterol, we would consider maybe lower BMIs for consideration of bariatric surgery. I think we have moved forward quite a lot with nutritional management, with medical management. However, there still remains a huge role for bariatric surgery. We do not have the capacity to offer it to everyone, and therefore we tend to prioritize people who have other disorders that are resulting from obesity.
Thank you, Dr. Sarah. Dr. Abdul Jabbar, another question, Doctor. عليكم السلام. سكرتها. One minute, Doctor. Yeah.
Thank you very much. Now, what we observed here that still the medical treatment for obesity is much far from the optimal treatment for these children. The way that I see most of the drugs that we have been, or it has been presented here, they have side effect. More, or nevertheless, many of those antidepressants, which are being categorized as serotonin inhibitor and things like that, they may lead to obesity by itself, rather than for the weight loss. The only way is just to increase the price of these medications, so the patient will have no choice except that reducing his weight and obey to be treated by by dietary regime and things like that. So I think that will be the best in case of using all these side effect things. Thanks.
Thank you, Dr. Abdul Jabbar. Yes, Dr. Sarah, any comment?
Thank you. Thank you very much, Dr. Abdul Jabbar, for your comment. I beg to differ with you. Obesity is a disease. It is not a choice. We would not tell someone with diabetes or with cancer, go away and stop eating. It is centrally regulated. It results from genetic factors. Food choice is genetically determined. How much exercise you do is genetically determined. I think we have changed a lot from the days of stigma and finger pointing. We have moved towards supporting people in their treatment. We have many treatment options, including lifestyle and nutritional management, including medication, including surgery. However, I truly believe that we can do better than to say go home and just stop eating.
Thank you very much, Dr. Sarah. I think we have two schools. One school, they think that the obesity is a disease. The other school is still, it is only a sign, and we can deal with the lifestyle, to change in lifestyle. And this is will be approved in future, that it is a disease, and we have to use maybe the medication. Any other question? Dr.
Sorry,
Sarah,
can I just come back?
Yeah.
So today is World Obesity Day. And if we go out with nothing, please can we go back out with nutritional management being an option? It's not an option. Of course it's an option. But obesity is a disease. And our role is actually to support people living with obesity.
Yeah. Thank you for reminding us that today is the International Day of Obesity. And we hope we can, all of us, we can fight this disease. I have a question, Dr. Sarah. What about if our patients, they insist on using medication, especially the one on counter, and they are not following the NIH guideline? Any health hazard if they use it, if they are not following the NIH guidelines?
So like you, we struggle with patients who have a normal BMI, who would like to have medication or even surgery. And do not qualify for their weight, does not qualify them for having that treatment. The side effects are exactly the same, no matter what weight you are. For anything on earth, you would risk the side effects if there is a benefit. For people of normal weight, there is no evidence that there is a benefit beyond, I can wear that dress. And so we would not at all recommend medical management for people of normal weight.
Thank you very much, Dr. Sarah. Any other question? Thank you very much, Dr. Sarah, for being with us. Thank you very much for